Hi everyone, my name is Marcus Simpson. I'm with SurgeryPRO. Thanks so much for joining me. This video is intended for gynecologists, urogynecologists, and urologists. I'm here with Chris Hufnagel of InControl Medical. Chris is going to tell us about a recently FDA-approved device called InTone, approved February 2012, launching throughout the United States and New England, and we are providing the device throughout certain segments of New England. And this is an in-home device used to treat stress, mixed, and urged incontinence. It's very exciting. Chris, tell us about it.
Thank you, Marcus. So today we're here to talk about InTone. As Marcus mentioned, it is a Class 2 FDA-cleared product for treatment of stress, mixed, and urge incontinence for female patients. The device is designed to be an in-home product, so the patient is actually shown how to use the device in the clinician's office, and then she goes home and she uses it once a day for 12 minutes in the privacy of her own home for 90 days to treat stress incontinence or for 180 days to treat mixed and urge incontinence. At the end of her treatment, the 90 days or the 180 days, she then simply uses the device in the privacy of her own home for maintenance once or twice a week to maintain her pelvic health and keep her symptoms in check.
Okay, so this is a single patient use device, and it is covered by insurance, Chris?
So currently, we have national Medicare coverage. Medicaid typically follows along with Medicare, and many private payers have already started covering the InTone.
And if I was a physician and interested in this device, tell me a little bit about the workflow and what I can expect.
Absolutely. So a patient will come in, and if they have stress, mixed, or urge incontinence, you can prescribe InTone for them. You'll simply send a request form over to SurgeryPRO, and they will pre-certify or pre-qualify the patient's coverage and make you aware of their coverage options. SurgeryPRO will then send a unit to your office, and you will have a specialist from InControl Medical come in and train your staff on how to use the device and implement it into your practice. Typical setups for initial patient setups are anywhere from 30 to 45 minutes, and then the patient will come back every 2 to 4 weeks for follow-ups, at which time you can check to measure the patient's progress and see how their symptomatic improvements are occurring.
And I'm just going to reiterate this workflow a little bit. So a physician that's interested in the product will prescribe the product or select a group of patients that would be candidates for the devices. They'll be pre-authorized. Units will be shipped to the practice, and the units will be dispensed from the practice. Is that all?
The wonderful thing about InTone is that it's a very conservative approach to treating stress, mixed, and urge incontinence for your female patient population. So typically we'll have an LPN or an APRN or a nurse practitioner or an RN that will implement the InTone in the practice. So the doctor, while they can prescribe the device, their time is very valuable, and they can utilize their staff to help treat patients with stress, mixed, and urge incontinence with the InTone.
Tell me about the performance guarantee offered by the company.
Sure. So as InTone is a new product, we currently don't have our documented research papers out just yet. They will be coming later this year. So there are more than 3,000 patients that are currently utilizing InTone across the country. And with regards to that, we actually provide a performance guarantee for any patient on InTone. As long as they follow the protocol that is set out by their clinician, they use the device once a day for 12 minutes for 90 days or 180 days, it is guaranteed to work or their money back.
Moving on to insurance. Medicare covers this device. Most Medicaid programs will cover, as they will follow suit to Medicare. As we know that Medicaid is a state-run program in Connecticut and other states. Connecticut Husky does cover. Many major medical carriers are covering the device, and we expect the majority, if not all, major medical carriers to cover as efficacy and demand is demonstrated. Now, there are payment plans available for patients who do not have carriers that cover either no insurance or a major medical carrier that declines the equipment, and these payment plans are 3 months of equal payments at 0% interest, and a 6-month program at very nominal interest for your patients. This is also very good in combination with the performance guarantee, enabling your patients to use the device without risk of out-of-pocket if it's unsuccessful. Thanks so much. For more information, please visit www.surgerypro.com. You can also email info@surgerypro.com or call our main line at 203-204 2874. You can contact Chris Huffnagel. And Chris, what is your best contact?
You can reach me directly at 978-660-9420, or you can email me at chuffnagel@incontrolmedical.com.
And that's C.
HUFNAGEL.
Great. So now, if you're interested in more information, we can mail you information, and Chris will also come by your office, or one of his team can set up an appointment. If you have patients that you would like to trial on this device, contact us for a setup package. We will send you out the templates. You prescribe patients. Chris will show up, train your staff, and we'll get your patients dry. Thanks so much.
Thanks.